Hello, everyone, and welcome to this audio podcast. This audio podcast is part of a ZtormLabostix article. This audio podcast is part of a Ztorm. This audio podcast as part of a Stax'n'um edition. This audio podcast as part of a ZtormLabostix production. In this audio podcast, looking at Haemolytic Uraemic Syndrome and Haemolytic Uraemic Syndrome. Uraemic Syndrome sort of signs and symptoms. So some of the signs are in where literature has evidence where literature has evidence and is concerned is where there's patients who present with abnormalities in around hemoglobin, so anemia. Where there's anemia, there's also signs in around petechiae or purpura, in amongst pediatrics. Excuse me, in around pediatrics and young people who are diagnosed with HUS. So petechiae is where there is almost like flecks on varying parts of the body. And then there's purpura, which is where the skin has a sort of a in certain areas and certain parts of the skin or skin lesions. There are areas of the skin where in pediatrics and young people who present with some of the signs and symptoms have a sort of a bruising look on or appearance on certain areas of skin in amongst across different areas of the body. And fever is also somewhat common in young people in around some of the signs and symptoms. There is and can be gastrointestinal bleeding, which is often found which is often found and associated with a sort of diarrhea, which is on emptying the bowels. On emptying the bowels, the child or young person will also have an appearance where the diarrhea has some blood remnants or some blood remnants within the diarrhea. In around the symptoms, in around sort of other symptoms, the kidneys are swollen and pale. There's many flea bite sort of hemorrhages on skin surface again, which again is in keeping. The flea bite hemorrhages are in keeping with the petechiae and the purpura. And there's GI involvement again, which may lead to symptoms of acute abdomen with an occasional perforation. Gastrointestinal disease may be severe with hemorrhagic colitis, toxic megacolon, rectal prolapse, and bowel necrosis. There's also cardiac involvement, which may lead to CHF and arrhythmias. There's also microinfarcts in the pancreas or around the pancreas, which can lead to pancreatitis, or rarely or somewhat rarely in around independent and in around the symptoms of IDDM being insulin dependent diabetes mellitus. And then in pediatrics and young people, also there's hypertension, or there can be hypertension, hypertension abnormalities in arterial blood pressure, which may be increased with blood transfusion. Transfusions are somewhat used in amongst ped, or have been used in peds and young people diagnosed with HUS historically, and it may contribute to central nervous system dysfunction, or CNS dysfunction. There's also symptomologies where there's anuria and oliguria. So in some cases there's pediatrics and young people who have the who have who may for example have the sensation to void, but are unable to. And then there's in other pediatrics and young people who are diagnosed with HUS, there's oliguria, which is a complete sort of incapacity to void at all. And then this depends again on overall glomerular filtration rate and renal function. So really in amongst pediatrics and young people, where sort of renal conditions are concerned, or kidney conditions are concerned, hemolytic uremic syndrome is one of the highest on that list, where it causes severe sort of abnormalities in pediatrics and young people who are diagnosed with this. That draws this audio podcast to a close. This audio podcast, as part of a ZtormLabostix article. This audio podcast is part of a Siege Solar Storm, and this audio podcast is part of a Stax'n'um edition, and this audio podcast as part of a ZtormLabostix production.